There's a condition called Addison disease. What is Addison disease?
Addison's disease is a condition that was named after Dr. Addison, who first described it. And just like we have Cushing's syndrome, which is a condition of cortisol excess, Addison's disease is a condition of cortisol deficiency. And this can occur as a result of destruction of the adrenal gland, which is a triangular-shaped gland that sits on top of the kidney that makes a hormone called cortisol, amongst others, or a destruction of a part of the brain that stimulates the adrenal gland to make cortisol. In individuals who have either one of these conditions, that is, a destruction of the adrenal gland or of the gland in the brain that makes the adrenal gland make cortisol, one can experience a variety of symptoms, including loss of weight, increased skin pigment, loss of energy and fatigue, diarrhea, heart weakness, and ultimately coma and death if not appropriately recognized and treated.
So in other words, if you have these symptoms, a doctor could do a blood test, and if you do find it, how is it treated?
It's fortunate today that with a relatively simple blood test, most endocrinologists can make the diagnosis of Addison's disease fairly readily. And once that is done, the treatment is quite simple. It involves the replacement of cortisol through taking a pill and advising families that in times of stress, either with an illness or surgery or in case of a trauma or accident, the increasing of the dose of the medication, just like the body itself would increase the dose of its stress hormone naturally, one would have to do that in somebody who is dependent on taking it in pills. And if they couldn't take it by pill form, either because they were vomiting or had stomach upset, there are fortunately injectable forms that can be used in its place.